Hello, my name is Ashleigh Griffiths and I'm a project officer working with HNE Kids Health. Today I'm speaking to you about the findings of a series of semi-structured interviews that were conducted with health professionals, parents and carers of children with medical complexity in Hunter, New England. These interviews were undertaken as part of the discovery phase of a quality improvement project known as HNE Kids Compass, which was funded by the Ministry of Health to develop a co-designed model to better connect and coordinate care for children with medical complexity in Hunter, New England. Children with medical complexity have multiple significant chronic health problems that affect multiple organ systems, resulting in functional limitations, high healthcare use, and often the need for medical technology. These children and their parents and carers face many challenges when juggling their care with multiple teams, such as family disruption, logistics, and being away from school and work. To better understand the care of children with medical complexity, we conducted 31 semi-structured interviews. 32% of these were with parents and carers of children with medical complexity, 55% were with frontline staff, and 13% were with managerial staff. We did an inductive thematic analysis of the interview transcript using Frank's narrative typologies to structure our qualitative data. Imagine these typologies as distinct patterns or stories that emerge when people talk about their experience with children with medical complexity. The restitution narrative is where illness is seen as a temporary disruption, challenge, or test. This narrative was noticeably absent from the stories that participants shared with us, which makes sense. We are talking about lifelong chronic conditions, not temporary disruptions. The chaos narrative is where illness feels overwhelming and disordered, and the quest narrative is where people see their illness as a mystery or puzzle needing to be solved. Through coding the interview data, we uncovered a new typology, which we've named equilibrium. Participant narratives that aligned with this typology describe their experiences as a series of negotiations or balancing acts between healthcare stakeholders. I'll go through each of these typologies with you now. The chaos typology highlighted the fear, confusion, and siloing that many families face when trying to navigate the medical system. Many families voice their disappointment at being expected to manage multiple teams and act as the primary conduit of information across them. Here's a quote from a parent. Most days I'm in total fear of what to do and who to contact. I don't know who to trust or who will help me. The healthcare system seems so complicated and I feel completely incompetent. While some participants told these stories of constantly being caught in a storm, others saw it differently. For them, the chaos wasn't just turmoil, it was a call to action. The quest theme reflected experiences of pushing past real or perceived barriers in order to reach a positive outcome. Here's another quote. You almost have to know the language and you have to know what information to give and why it's important too. But there's another side to this story, and that's where equilibrium comes into play. The equilibrium typology encompassed the internal struggle of parents and carers to fulfill their role as an expert in their child's care, balanced with not wanting the full encumbrance of being a care coordinator for their child. Here's the quote. We do a lot of what the nurses would normally do because, it's what we do every day, so it's fine. But to then not give us the respect of consulting us a bit more, like we're not doctors by any means or anything like that, but we do know the child, and together we could work really well. In addition, we found that both families and staff often experience a lack of clarity around whose responsibility care coordination tasks should fall to. One service manager described that the most complex patients were the ones that missed out the most, in that everyone thinks that everyone else is doing it. Here's a quote from a nurse. I think that some of the challenges at the local level are passing the buck or believing someone else will sort it out, and it's not my job. I think it's unfair for families to be caught in the middle of that. The findings of our study will contribute to the growing body of knowledge on integrated care for children with medical complexity. By understanding the themes within the equilibrium typology especially, health services and professionals may be better able to create models of care that are responsive to the individual needs of the family and better incorporate the role of the carer. These findings have certainly helped inform the development of a new model of care for children with medical complexity in Hunter, New England, which is currently being trialled. Thank you very much.